Hello, everyone, and welcome to this extended edition of the Dance NYC Fieldwide Call. My name is Sarah, and I am a research and advocacy assistant here at Dance NYC. My pronouns are she and her, and I'm coming to you today from Muncie and Lenape land, currently known as Upper Manhattan. I am a non-disabled, cisgendered, mixed heritage Latinx woman with short, blondish hair. I'm wearing a black shirt and gold hoop earrings, and I'm sitting in front of a light colored wood background. I'm joined today by Candace Thompson-Zachary, Senior Manager of Programming and Justice Initiative, Greg Udam, Research and Advocacy Coordinator, and Izzy Dow, Programs Coordinator. Some housekeeping elements for the call today. Today's call is being recorded, and the recording will be posted on Dance NYC's YouTube page, as well as the Reopening Dance in NYC digital toolkit website next week. We'll drop links into the chat for those two sites. As far as accessibility features today, we have two interpreters with us for ASL. We thank them for their partnership with us. Note that we will always have an ASL interpreter visible in the call. Every 20 to 30 minutes, the operations team will switch out the ASL interpreter. The panel will carry on as usual, but just naming that you may notice this. We're also partnering with the wonderful Viscardi Center for closed captioning services for today's call. You can use the CC button at the bottom of your Zoom screen to view captions. We'll also drop a link in the chat to access the stream text transcript. Other notes, please stay muted unless you're speaking. If you are speaking, please introduce yourself and your organization. And if you're on camera, please give a brief visual description for accessibility purposes. For our interpreters and captioner, a general note to please be clear and loud and maintain a moderate pace while speaking. If you have a question, please put it in the chat or feel free to raise your hand or unmute to share with the group. If you would like to ask anonymously, please message any of the Dance NYC staff on the call. If you have any questions or concerns about using Zoom or require technical support, please feel free to message one of us. And if you have any questions regarding any of those housekeeping aspects, I can answer those questions now. And a reminder that we use a running agenda to take notes during this meeting. And a lot of the resources that we've collated from these meetings are collected in the Fieldwide Call FAQs document. We'll drop links into the chat for both of those documents so that you can follow along. We'll also drop some community guidelines into the chat at this time for you to read and reflect, and let us know if you have any questions about these community guidelines. And moving on to our land acknowledgement, Dance NYC would like to recognize our country's history and its legacy in the space we occupy. Parts of this acknowledgement have been adapted from the guidance of Indigenous dance artist and activist Emily Johnson, who worked on Dance NYC's land acknowledgement. I would like to acknowledge that the city of New York is on stolen land, more specifically, Lenapehoking, the unceded homeland of the Lenape people, who are also recognized federally as the Delaware Nation of Oklahoma, Anadarko, Oklahoma, Delaware Tribe of Indians, Bartlesville, Oklahoma, Stockbridge Muncie Community, Bowler, Wisconsin, and in Canada, Muncie Delaware Nation, Moravian of the Thames First Nation, and Delaware of Six Nations. We recognize that as an organization based in New York City, we have benefited and continue to benefit from the systemic displacement and subsequent erasure of Lenape people and governance on their land. Please join me in taking a moment to recognize and reflect on the centuries of violence, displacement, forced migration, and settlement here, as well as the centuries of resilience and leadership of all Indigenous and First Nations people on Turtle Island that have led to our livelihoods in New York City today. We also acknowledge and mourn all the people whose lives have been taken by the actions of white people, institutions, and systems, and the many accomplices, witnesses, and beneficiaries of white supremacy who have actively participated in or stood by and observed in silence. Take a moment here as well. Thank you. All right, we'll move into some brief resource sharing. We're excited today to have the New York City Department of Cultural Affairs Commissioner, Gonzalo Casals, and some guests from the New York Independent Venue Association, Tamara Kasheki and Morgan Dean. They'll be with us here today to discuss the Key to NYC vaccination and safety guidance. We'll share most of the resources in the follow-up email on Monday, just to allow our guests as much time as possible to share information and to field questions from the audience. So some timely resources for Hurricane Ida impact. If you or your organization have been impacted by Hurricane Ida, you can apply for federal assistance through FEMA. You can also explore more federal, state, and local resources, assistance, and mutual aid through Dance NYC's Hurricane Ida Emergency Response resource page. We also have the Hurricane Ida Dance Impact Survey, which you can complete as an individual or on behalf of your organization so that Dance NYC can better respond to the needs in the community. You can also submit relevant resources via the submission form on the resource page, or you can email info@dancenyc. And we'll drop links in the chat for those resources. Governor Hochul recently expanded eligibility for the Pandemic Small Business Recovery Grant Program to cover COVID-related expenses for small businesses. I'll note that this still doesn't include nonprofits, so we have a ways to go for advocating for recovery for the nonprofit arts and culture sector. The Emergency Rental Assistance Program is also providing funding for emergency rental and mortgage assistance through state and local programs. And you can find more information from the Consumer Finance Protection Bureau, some information for renters and homeowners, and a media toolkit for organizations to share information. The National Coalition for Arts Preparedness and Emergency Response has generated an arts field guide to federal disaster relief, which may also come in handy for those of you impacted by Ida. You can download that field guide. We'll drop a link in the chat for that. And last but not least, you can join the New York City Artists Coalition to advocate for commercial rent stabilization to prevent small business closure and cultural displacement. You can find more information about the bill. We'll drop a link in the chat for that and learn more about the bill's proposals and sign on to support fair rent in New York City. And Lucy Sexton, if you're here on the call and want to give an advocacy debrief, we welcome you.
Thank you so much, Sarah. No, I'm here to listen and engage in the conversation with the commissioner. So I think I'll stick to that today, but thank you.
Okay, fabulous. And with that, I'll pass to my colleague Candace to moderate this section with the commissioner. Welcome and thank you.
Hi, everyone, and welcome, Commissioner. My name is Candice Thompson-Zachary. I use she, her pronouns. I am the Senior Manager of Programming and Justice Initiatives at Dance NYC, and I'm currently on Lenape and Canarsie land. I'm a non-disabled, cisgendered Black woman of Caribbean heritage. I'm currently wearing a green shirt. I have ombre faux locks, and I'm sitting in my living room that is blurred right now. Because of the Zoom background. Yeah, I'm pleased to welcome Commissioner Gonzalo Gonçalves to speak today about the Key to NYC vaccination mandate and hopefully clear up concerns and questions that we have. And I'm glad the community is here. So I'm sure you're going to hear more from them as we go along. But Commissioner, I'll turn it over to you just to give us sort of an overview of what your office has been doing, the updates that you have from the mayor's office. So yeah, give us your kind of overview, and then we can get into more specific questions that I'm sure will roll into the chat, and we have some prepared for you too.
Of course. A couple of things first. Thank you, Candace and Sarah and everybody at Dance NYC for inviting me, but also for doing this amazing service to the community. A couple of disclaimers. It has been 2 very hard emotionally and intellectually weeks with so much happening in New York City with the storm, the vaccine mandate, public employees returning to the office. So I'm not at my best. And if I don't make sense, I promise I'll come back and I'll give you a better version of me in the future. And then the other thing is I have a cat that for some reason is hungry now, so you'll have to put up with that. Key to New York City. Let's start from the very high level. Unfortunately, the levels of infection in New York City continue to rise. The strategy that was put together by the scientists at the city and the health department was let's bet on the vaccine. Let's make sure we can get as many New Yorkers vaccinated. This is unfortunately not going to stop you getting sick with a Delta variant, but at least in most cases won't send you to the hospital. The other challenge that we have is that the levels of vaccination are not at the level that we want it to be. And I just want to make a parenthesis here because mainstream is talking, it just talks about community of colors, not wanting to get vaccinated. And it's a little more nuanced than that. And I was making that mistake until I really went to see the numbers. And yes, the African-American community is one of the communities with the lowest rate of vaccination, but Native American and Asian are really high, above what we wanted to see, 79, 80. Latinx is 50s, and then white and African-American are low. And it's just, again, I wanted to say that because we want to be careful how we talk about the unintended consequences of this policy. So what the plan is, how do we move from incentivizing vaccination to enforce it somewhat? There has been some sort of exploration at City Hall, and they realize that if we at every step of the way in the life of New Yorkers, we're constantly stopped and reminded that we need to get vaccinated, or that because you're vaccinated, you're getting a full experience of what New York City looks like, we'll be able to increase those rates of vaccination and stop the increase of infections by the Delta variants. One of the challenges with having spike like the one that we had last year in New York when we were the epicenter is that when you have moments like that, the virus could mutate and continue to create variants. So it's not only about saving people, but it's also stopping the pandemic. For a few reasons that unfortunately don't look very kind to our sector, there are aspects of the city life, if you will, that they're essential. And the word essential is complicated, and we can discuss that later, that we cannot put obstacles for people to access to, right? We cannot ask people to be vaccinated to enter a supermarket because they need to have access to food. I said unfortunately because I'm preaching to the choir, and I wouldn't be the commissioner of cultural affairs if I wouldn't tell you that arts and culture are essential. But from a legal perspective, arts and culture, entertainment with hospitality and restaurants are the industries that legally we could put obstacles in order to enforce that. We spent some time between the initial announcement of what this policy was going to look like, talking to folks in the sector. Lucy was part of some conversations. She was very vocal, and I don't have to say that because you all know Lucy, but she was doing her job, and I appreciate that. Alejandra was part of that too, and we were able to here and there make a little changes. But the challenge that we have here is, while all of you are where the rubber hits the road, right? You're at the community level, you are at the people's level, right? And the mayor is at the 10,000 feet view of the city. When a decision has to be made, the mayor prioritizes public health over, other industries. And then you have the commissioners in between that needs to be translated. That kind of view up here and the decision, understand what the implications are, where you at, and try to figure out how the policy could be managed. That's a very imperfect process. Policy is a very messy thing. And I do recognize, again, that, and I want to hear from you, that this policy may affect you in so many ways. But believe me, we're trying to do this because we don't want to go back. And in particular, for the performing arts, dance, theater, we don't want to go back to where we were a year ago. If we are not able to stop the race of infections, we're going to have to come back and bring back some of the restrictions. I'm going to leave it at that because I'd rather answer questions and talk about what is of interest to you.
Thank you, Commissioner.
And please call me Gonzalo.
Gonzalo, sorry.
I'm not that old.
Okay. Thank you, Gonzalo. Thanks for just kind of giving us some context for how you're approaching this. I want to open the floor to questions at this point. I have some questions that are in a bank, but I think I want to prioritize people who are here and want to ask questions directly. So if we could do either drop it in the chat if you have a question, or do raised hands, and I'll try to field the ones that I see. Lucy, go for it.
Yes, you know that I'm very shy. I don't like to speak. Gonzalo, first of all, take care of yourself. It's been a lot. So, but I just wanted to ask for your advice, or if you have any advice for us. One of the overarching responses that I have heard and that I have on behalf of the cultural field is that there has been no funding for this, right? We are being asked to implement public policy. We are being asked to furlough employees who may or may not be able to get unemployment. We are being asked to deny services to families who need it. and maybe we can't afford to supply another form of engagement for them. And it's no matter what we do, it's going to incur a lot of costs, right? In extra staff and developing these systems for registering vaccination, et cetera, et cetera. I know that there is still relief money, ARP money in there. Was just a great announcement about the ARP money for the DOE, 20% of it having to go to the arts and culture. If we were going to ask for money from the administration, if we were, what can you give us any advice on where there's still funds that maybe could be used to support us having to enact these policies?
Yeah, and thank you for that question, because I wanted to say something related to what Sarah said, and I forgot. FEMA and for the storm, the first thing that you want to do is document, right? Before you clean, before you fix or anything like that, make sure you have enough documentation of the damage that the storm has done to your spaces. It's great that FEMA has kicked in, but it's a very complicated set of grants, and the reporting is very thorough. So you want to make sure that you document that. And then, and probably, again, there's a lot of things happening in the city these days, but probably we are going to be releasing some guidelines. Not everything that was destroyed, unfortunately, by the storm may be eligible to be paid with FEMA money, right? And we'll come back to that. Maybe Candace, I'll talk to Ryan and we'll do another session about that. But I want to make sure that in the moment that you're trying to clean up and whatever, you don't forget to document. I brought that up, Lucy, because very much like last year, if you look at this mandate, which has to do with public health and it has to do with the pandemic, it's very much the cost that you're all incurring can be related to the cost that you had last year. And there were most of the money that was coming, to support with that is federal money. The city doesn't have, we did not expect this, and the city doesn't have sort of in the budget, a mechanism to do this. We could advocate in the next budget process, which is next year, to put some money that has to do with relief. It gets complicated because the expense money that DCLA gives is to service for New Yorkers. I could make a claim that fixing your stage that was ruined by the storm helps you do that service. But I think the point, do you want to put pressure on the federal government, or at least pay attention to stimulus package and see how much money is out there to invest in arts and culture infrastructure? I told you I'm all over the place today, I know.
Thank you. No, that's great. And great to get that FEMA information out there. Thank you.
Thank you, everyone. I'm going to acknowledge Morgan's question in the chat. Would like to know more about the city's policy on exemptions around medical and religious exemptions. There's been some conflicting information. So I don't know if you have any clarifications around that.
Yes, I'm going to answer the question very short, and then I'm going to expand it. The easiest way, go to the Commission on Human Rights, city agency, and there you're going to have front and center both medical and religious exemptions to the mandate, and it's just right there. That said, I also recommend you that you go to the main website of Key to New York City. We have reorganized the frequently asked questions by sector. Don't get upset with me. I got upset with my staff. We fall under entertainment. Nothing wrong with entertainment, but I wish we could talk about culture. but that's easy for us to and for you to figure out, the information that you want to have. And then the other piece of information, this is a policy that is evolving and a lot of questions come up. So at least you should check it once a week, because once a week we're constantly updating that portion of frequently asked questions. If you go there first, you have a link that takes you directly to the Commission on Human Rights portion of accommodations for religious and medical reasons.
Got it. I think Morgan has some follow-up questions because there are some specific parts of that people are having issues with. Morgan?
I do. Thank you, Gonzalo. And I had not seen this particular FAQ document, so thank you for sharing it. And I apologize if any of the questions I ask are answered here, but if you could humor me, just since I have you in front of me, I want to make sure I answer them on behalf of
Go for it.
So some of our members have been given directives, and these are on, I think it was one of the early actual NYC, those early New York City government calls, sort of like those open format calls that were for venues to call in and sort of ask questions and talk about the implementation of Key to NYC. The feedback that they got on those calls and have gotten on subsequent calls with various and sundry organizations are, if somebody claims they have a medical or religious exemption, you have to, the reasonable accommodation that you're making for them is that you can provide a digital experience for them, a remote digital experience for them, stream the show, but they cannot come in. And a reasonable exception, say, of wearing a mask or presenting a negative test is not sufficient. Is that inaccurate? Is that inaccurate guidance?
No, that's how it is. And I apologize, I conflated two things, right? There is the reasons why you need an accommodation, and that's at the Human Rights Commission, and then what the accommodations look like. And the accommodations should never be bypassing the policy itself.
So there is currently no accommodation to make in our case for, this is, independent venues, for a person who is claiming an exemption physically within the venue. There's no exemption for them. Okay, or exception rather. And
No.
then does that also apply to staff?
Yes. So can they work from home? Can, you have to figure out ways, but the idea is that you are in one space, and if you're not vaccinated, if you're not, you are putting everybody at risk. So no matter what the reasons, you're not vaccinated. Science is science, right? So that's the simplest way of understanding the criteria.
Okay, thank you for that.
I was going to tell you it makes sense. Probably doesn't make sense, but it's understandable, I guess.
Yes, no, I understand. For us, I have the objections or agreements I have with that policy are certainly for another forum. I'm mostly just interested in getting some clarity. So thank you very much for that.
Thank you, Morgan. I'll pass it to Potri, and I just want to note we're at 4:32. We have Gonzalo until 4:55, so we just want to keep the questions short and to the point. Go for it, Potri.
Hi, Potri.
Hi, good afternoon, everyone. Assalamualaikum. I'm actually at my storage right now, and I just so sad that some of my materials, the storage is not mine. Actually, it belongs to the cultural group Kinding Sindao. So I just want to notify everyone. I'm trying to deal with the CubeSmart right now. What are we going to do? The other one is I think Candice reacted to the announcement that I was assaulted at the subway in August 10, 2021 at 6 p.m. And the reason why I was assaulted because I was giving mask to the two couple who are sitting beside me. And being a public health nurse, I'm a 24/7 public health nurse. Whether I'm paid or not, it's our obligation to suppress or to drive away COVID. So I'm just relating this to COVID-19, how angry people are and scapegoating and victimizing, using Asian slurs like go home to China, dirty Chinese, something like that, or mind your own business, chink. Those are the words of the assailant. And in fact, like, get out of this subway terrorist. So I'm wearing hijab. I'm just presenting this as an artist, all through and through. And I do know, just presenting it because right now, we're helping people around me in Queens who are flooded. And today, just to discover that there's a lot of damages. So I'll deal with that with the storage. And I just got some news that I was not able to get a grant for $10,000, which is from Queens. So that's all sad stories. It's not a question. It's just a presentation on how can we, artists in very small budget, can be helped in this calamity.
Thank you.
Thank you.
Poetry. I think just part of what Poetry's experience just highlights is that a lot of people are having to deal with the frustrations that patrons, clients, dancers are sharing in having to deal with the mandates if it is not in it's not in alignment with what they think should be happening. And that's what a lot of our entities, dance studios, are having to deal with, this kind of frustration and interaction with the public. So
yeah, I mean, first of all, Poetry, I'm so sorry that you have to go through that. It's just, I cannot believe the level in which this country got, that we need to politicize public health. I hope you're okay now. What I've been saying is, and this is something that the Deputy Mayor Bean said in a few meetings, is there's the period of which is about to expire Monday, which is about implementing, and then there's the period of enforcement that starts on Monday. What I want to make sure, there are a couple of things. The city put some de-escalation trainings online, and they're all in that website where you have the frequently asked questions that may help you share with your staff how to deal with situations like that. But what I've been saying is, I don't want any of our workers, cultural workers, to be to suffer because of this. So the easiest and the first recommendation I would be doing about de-escalation is be flexible. Tell people, you know, it's okay now, but next time that you come, you should know that these are the policies.
thank you. I know that there are some questions about, so there's a question in the chat about why, if people, I'm assuming the subtext is if people aren't vaccinated, if testing is not a safe option, basically to get around the vaccination mandate for people to be indoors or in spaces. And there's a related question from someone who is an organization that's not here, is about basically the fact that the policy kind of alienates communities of color, especially for organizations that are in very, I guess, culturally specific neighborhoods. It basically kind of alienates most of their clients, their audience. Is this going to change at any point, I guess is the question. Is there possibility for workarounds?
Let me answer the later part. I forgot the first part, and I'm sorry you have to repeat it. The later part, unfortunately, and this is something that Lucy and Culture 3 and everybody was pushing back, but unfortunately, it got all the way to the mayor from multiple channels, including me, deputy mayor, and press. And the mayor is very sad that he understands these and the unintended consequences, but he's prioritizing public health.
Understood.
And we don't have an end to this until things change, right? There's not a 3-month, 4-month deadline. And then remind me the first part, sorry. I know what it is. And this is Lucy's favorite question to ask. It seems there's a little bit of a double standard between the way of the mandate treats private employees, city employees. And that has to do with city employees that are not vaccinated could opt for a testing option, and private employees don't have that option. And I'm not gonna go super down on that because I don't know all the details, but it has to do with essential workers, some situation in which we cannot get rid of all our doctors, or we cannot just fire them because they don't want to get vaccinated. So we'll have to create an option for that. Again, you can tell me that your dancers are as important, and I will agree, but this is how the city sees it.
Received. I shouldn't say understood, but
And
acknowledging.
again, I'm preempting, a lot of things that you're saying. That doesn't mean that you cannot repeat it and yell at me, right?
Right.
Go ahead, Candace. Sorry, I interrupted you.
No problem. I'm gonna hand it over to Christopher, who's had his hand up for a while.
Hi, Christopher.
Hi. Thank you. So thank you for being here with us, first of all, and for being on numerous meetings recently. Our studio is doing our best to comply, and overall supports, vaccination. I have heard that there are some studios, that just intend to ignore the rule. If they get fined, pay the fine and just keep going, and take everyone's business. And this is really frustrating. And so I'm wondering, if fines can escalate, if they can be shut down, what is the mechanism for dealing with this?
This is a really challenging situation. And it's specifically in this sector where the lines between for-profit and non-profit are very blurry, right? I intentionally, and again, both the mayor and the deputy mayor said it, right? We're not looking to this to be punitive. We just want to solve a problem that we have. I want to be careful of us organizing a campaign to go out and sort of be punitive to certain dance studios, because we saw what happened last year with many dance studios that were wrongly closed and fined, right? You can certainly call 311 and they could give you information where to make the complaint. Most of the city has been, city employees have been stretched thin, so there's not a lot of resources for people to go around looking to see who's enforcing this or not. And same last year about being closed or open. Most of the enforcement happened because neighbors were calling or somebody was complaining. So you can certainly do that. And again, I'm sharing my concern that I don't want to sort of create a campaign that then would come biting us in the ass. I'm part of my French.
Okay, thank you. So I guess we all do our best and just hope that we come out okay on the other end.
And Christopher, I don't know exactly. Is there a way that we can talk to these groups and make sure they understand, what could happen as a community? I know it sounds a little naive, but that would be my first reaction to this.
Okay, jumping in here
Thank you.
because I want us to get all the questions in. I'm going to lump a few together. I see Lucy's question about, do we think that we can get a cultural carve out so to allow non-public facing office staff to follow the requirements that other office workers are? That would basically, they would kind of get around the vax requirement for, yeah. So that's one. And then there's another one
I
that's
don't think
similar.
so. And I'm going to answer with one sentence, I promise. Probably there's going to be other mandates coming in because we have to continue to push down on infections. So rather than, relax to compare with other things, we're going to increase to enforce that.
Received. There's a similar question about, and I'm reading Hannah's question from High Arts. It says, from the fact sheets, reasonable accommodations can take many forms. For example, an employee can work remotely or perform their duties in an indoor portion of the premises that is isolated from other employees. So they're asking if they can have a single artist in residence working alone in a studio, for example.
You know, that falls unfortunately in the realm of me making interpretations of policy for yourself, and I'm not your legal counsel, so I cannot answer that. But yeah, make sure you you get some advice if that's exactly the case and the way that the policy is understood. But yes.
Got it. Thank you. And then there's one more that's related to this, even though I think I'm getting the gist of the answers here. Is there a testing option for 12+ students that reside in New Jersey or Connecticut that are not vaccinated but come to New York City for training? And this, I guess, brings up that non-resident artist clause that's in the guidance.
I love the sector member because the questions are really creative about specific situations. Can you repeat it again? So you have students that are coming from out of state as performers.
Yeah. Well, yes, to take class, to train.
To go to school or to train on dance?
Yes.
I will have to get back to you on that one. I don't know.
Okay.
Regardless of their age, if they are performing, they're artists, and the out of state exception applies to them, 18 to 12. I'm not quite sure what happens with schools and private schools.
Okay. All right. So we'll circle back to that conversation. Question from Sarah. The idea that there is no end to, basically when the guidance will run out. Could there be a clause with a date for reevaluation or metrics by which this mandate would be subsetted? Basically, if infection rates
Every day.
go X.
It's every day, that day, right? It's the same as when we were just coming out from the first, when we were the epicenter, that we have the phases, but there were not dates. And every day we were figure out, when that moment will come in. And if you remember, Upstate was a couple of weeks before us. So every day, depending the numbers, is that day.
Understood.
And I know it's frustrating not to have a horizon after a year of so much turmoil, but it's really difficult to forecast that.
Understood. I'm opening the floor back up. Marilyn, I know that you had a lot of questions. I'm just wondering if I think those questions might be better answered by the next presenter. Right, DJ, your question. Are there regular updates to the policy details? Does it happen at a certain time on the website?
I don't know. What I would say is just probably you don't want to check it every week, but every 2 weeks you want to just check it and see. But also check it if you have questions, right? What I'm saying is that don't print it out and think that that's a static document. It's a document that's constantly updated. So you rather, when you have a question, go back to the website.
I have a question about clarity about what documentation we need to have to be in compliance and ensure that we are not fined.
There's no, each of you can decide, signage, you need to do that. There's a signage designed by the city. You can grab the content and design it to the liking of and the brand of your organization. And there's no guidance on how you memorialize this. If you collect information or, how many people came in and were vaccinated or not. What I want to say is there's no an emphasis on being punitive. And what I wanted to say is that if any of you, unfortunately, I wasn't aware that last year until very late, and Lucy made me aware. If any of you or anybody you know gets a fine, the first thing you do is send me an email. I'm not promising you anything, but I want to make sure that we look at exactly what was going on and how we can help the culture organization.
Okay, yeah. Lucy, you want to ask
And-
a follow-up?
And
then
Lucy has my email, so she can share with all of
Just
you.
a quick one, Gonzalo, is to please encourage that there be some standardization of it so that, you know, like dance studios, you have repeat, you know, students who come every day. Once you've checked their vaccine, is that good enough? Do you keep their vaccine status on record? And I ask for clarity only because, and I know they've tried to keep it open, and that's great, but it also does leave room for it to be enforced differently at different times if we don't know exactly what we need to have. So if you could just encourage them to provide some sort of clarity around if we've done this, if we have a sign in, if we say that we say that we've checked it, whatever it is that we can prove and say, yes, we're in compliance, we did what they asked us to do.
Understood. Again, it's going to be challenging to do that because probably each of your organizations is a different situation, right? And a different experience that calls for different things. And that's why we are like, we leave it to you how you memorialize and how you implement. And that's what I'm saying, that if for any reason, any of you, which I hope is not going to happen, gets in trouble, let me know, because most likely it's going to be because of lack of information or misunderstanding, and we'll try to make it work.
Thank you, Gonzalo. Marilyn, do you want to ask a condensed version of your questions? You're muted, okay, there we go.
Can you hear me now?
Yes.
Oh,
Hi, Marilyn.
okay. Hi. Yeah, a couple of dance companies whom we're, assisting and facilitating booking. The question's been going around, if the members of the dance company have been vaccinated, do they still need to wear masks? Do presenting organizations require that they wear a mask? And some of the response has been, if the company shows that they've been vaccinated, they do not need to wear a mask. Has this issue been tossed around a bit? Or we just need some clarification? We have a show in the record.
Let me make sure I understand your question. There's the level of risk management that the policy or the mandate brings, right? Which is you need to be vaccinated. If any of you or any of the places in which you are performing decides to go above and beyond that mandate, they can do that. And it's up to you and them to figure out if you do it or not. Is that your question? Like, all of a sudden you go to a theater that is a rental and that theater is asking the dancers to wear masks.
Yeah.
When the mandate is not asking for that.
Right, okay.
Yeah,
Good,
it's
yeah.
up to them. It's up to each everybody has to do the basic.
Okay,
Each organization can decide to go above and beyond
Yeah.
that.
okay, I think that answers the question. Thank you.
Thank you, Marilyn. Other questions? Pass.
Hello, hi. Quick question. Hello. I have a question about, posting the signage requiring vaccination, we're fine to do, but we're a little concerned if a patron or somebody was have pushback with that. Because you never know, right? There's people out there that are very aggressive right now. And we are concerned for the safety of the people who come here and also our safety. Is there a resource that with
Sorry, go ahead.
patrons like this? Yes.
Yeah, I mentioned before, the city put, I think it's through SBS, but it's all on the frequently asked questions, a training on de-escalation, and right, that you're in a situation and how do you keep the situation, from escalating. It's sort of a series of videos that you can share with your staff. You never know. and I'm gonna make a complete generalization, but I was in Staten Island, Snack Harbor 3 weeks ago, and I was actually asking, a lot, how is it working? Because I assume that's one of the areas in which, a lot of pushback would happen. And interestingly enough, they have not seen on the first 2 weeks a lot of that. But we should all be prepared.
Thank you. Thank you.
But again, I don't want anybody to leave their souls just because, they need to fight this.
Thank you.
Thank you. There's a question in the chat about DCLA funding, I believe. Will funding be compromised if we shift programs to virtual platforms because of all of these changes?
Yeah, and I'm going to add another question to that was asked to me a few weeks ago. You may suffer a decrease of audiences because you're just turning people away. Would this affect also funding? Very much like what we did last year, which we gave all of you, all our grantees, the opportunity to rethink your programs and to retell us how you use the money. A version of that is going to happen this year. And if that doesn't happen and you find yourself that you change completely the logic of the program or the attendance and what is expected or any other unintended consequence, make sure you explain that on the report. It should not be a problem.
Thank you. Do we, okay. I'm going to ask one of them that I have in the bank. If closures are mandated or result from inequitable implementation or enforcement of Key to NYC, how can organizations and their supporting communities be supported? So if, I don't know, someone's mandated to close or has to pay a hefty fine, is there a way to get support?
Those are very different things.
Looking for what?
Sorry, was somebody speaking?
No.
Sorry. Again, if somebody gets a fine, I'm not promising you anything, but let me know because we want to explore a little bit, what happened. If this mandate is the what pushes you over the cliff, unfortunately, I don't see any existing mechanism other than going back to federal government and stimulus money, right? And I don't know, I don't see anything in the near future. We have to see how things unfold.
Okay, thank you. And can we borrow 3 more minutes of your time?
Yes, I'm here until you need me.
Okay, thank you so much. We got like 2 more in the chat and 1 more that I want to ask. Do you feel there's any conflict between the New York City guidelines and guidance and the new safety plans required by the HERO Act announced by Governor Hochul this week?
I did not pay attention to that. If you can tell me a little bit more what this is about, or probably I will have to come back to you. Candace, can I ask you a favor? If one of you can send me this question or to Ryan, and I'll reply back to you guys and you can share in the next meeting.
Yeah, totally. We're taking notes, so we can send you a list of like the outstanding questions after.
Yeah, sorry about that.
No problem. Hannah from High Arch, we don't need to require photo ID and a matching vaccination card. We don't need to write down names when people enter. I'm concerned many places are doing this when undocumented or other folks may not want to prove their identity. And I guess
you need an ID, unfortunately, and that's one of the issues that concern equity. You don't need to necessarily memorialize the name and of everybody that came in. But,
is there any speculation about what that ID needs to be? Do you know what I mean? Like, could it be a library card? Like, does it?
Library card, yeah.
Okay.
I recommend that's an opportunity also to those folks that don't have an ID to use the ID NYC, which is extremely helpful. But yeah.
Okay. And then I'm assuming that, well, this is the question is, I'm assuming we are not required to store the data afterwards. They just need to check at the moment of entry.
Yeah, I mean, I don't know what, and again, this is up to each organization. I don't know how many of you are still doing contact tracing. And I don't know if this could be part of your contact tracing to figure out, you're collecting the information and use it like that. But that's at your discretion.
Okay. And to be clear, is tracing still part of the general mandate?
No, it has nothing to do with the mandate.
Okay.
And different organizations are doing it differently because they want.
Okay. Thank you. I'm going to open it up for maybe one more question if we have. Let me see. Are daily health forms still part of the mandate? I guess not necessarily the vaccination mandate, but the general sort of
Hold on a
practice
second.
around COVID safety.
My cat is yelling in my ear. I couldn't hear you. Sorry.
Are daily health forms or daily health declarations still a part of the mandate? But I'm assuming this would be not necessarily in the COVID mandate, but it would be a part of like general COVID safety practices.
Yeah, it's not part of this mandate.
Got it. But do you know if it's still a part of like general COVID safety?
I don't know.
Okay.
I'll find out.
Okay. Thank you.
We're good?
I believe so. Okay, one more just came in. Sophia, can you make it like super quick?
I'm trying to clean up my office, getting ready for next week. Just really quick.
Hi, Sophia.
You said, hi, Gonzalo. You said something about future mandates. And I just want to know if those.
An example of that is right after this came out, the school mandate came out, right? So little by little, we're looking at different sectors and figure out how we tackle the whole thing.
So I guess my question is more of, would these new mandates affect the cultural sector more? Like, should I be cleaning my office or packing it up? Like, I can't do many more mandates.
Appreciate your sense of humor, but probably this is not the week to say that. But yes, no, probably not mandates, but there is a possibility that we have to roll back some of the restrictions that we have seen last year, right? And nobody knows that.
Yeah.
I just want you to advocate for no more for us, right? Like, I think we have enough. So just let them know we're good where we are with the mandates.
I
Thank you.
promise you that I'm going to continue to advocate in general for the sector until December 31st.
Thank you. That's appreciated.
And if I'm not doing a good job, you can always email me. And
I'll tell Lucy.
You know.
And she'll let you know.
Yeah, Lucy's good at that. Yeah. Thank you, Sophia.
Thank you, Sophia. Thank you, Gonzalo, for joining and sharing so generously. I know there are still a lot of questions that need to be answered. We still have a lot of concerns. If people have more questions or more questions come up, send them to us and we could forward them to Gonzalo's office. But thank you so much.
We'll send them back to you. Thank you, everyone, and be safe. Bye.
Thank you. Okay, I'm going to turn it over to Greg to help us moderate the next section with folks from NEVA.
Great, thank you so much, Candace. I'll also just add before I introduce myself that if you want to put questions for Gonzalo into the chat, we are collecting them still. So we'll be able to send those out afterwards. So you can also just drop them directly into the chat and say like question for Gonzalo, and we will collect those. So welcome everyone. Thank you for joining us. I'm Greg, the Research and Advocacy Coordinator for Dance NYC. My pronouns are he, him, and I am on Munsee Lenape land in what is currently known as Chelsea. I am a non-disabled Latinx cisgendered man with short black hair and wearing clear glasses. I'm wearing a long sleeved gray t-shirt and I'm using a blue virtual background with the Dance NYC logo in the upper right corner. So I'll just say thank you to Commissioner Gonzalez for taking the time to answer all of our questions and to join us today. Now we'll welcome our guests, Tamara Kasheki and Morgan Dean from the New York Independent Venue Association to share their experiences and perspectives on opening key to New York City and resources for independent venues. And same as before, if you have questions, you can drop them into the chat or raise your hand. I will pass it over to you guys.
Hi, good evening. I'm Tamara Kashecki, she, her pronouns. I'm a non-disabled cisgender white woman in my gray office. I'm currently in New Hampshire, so I'm on Pennacook land. And I'm wearing a sort of dark purple shirt with long, dark black hair. So great to be here today. I'm just gonna let Morgan introduce herself, the incomparable Morgan Dean.
Hi, my name is Morgan Dean. I use she, her pronouns. I am a non-disabled multiracial person. I'm currently in the United Kingdom, and that is not covered on the map that was provided, so I'm not sure. I am sitting in a room with a sort of tan background and a red tapestry behind me. I'm wearing a black shirt and cat eye glasses, very bright red lipstick, and long dangly earrings. And I am the chair of the NAIVA Reopening Committee.
Great, so I'm just gonna do a quick share screen. I know we get a lot of those in our life these days, but just real quick, I'm on the board of the New York Independent Venue Association, which was started in response to the pandemic closures. So we're a young organization, we're a 50c6 membership organization, and we are comprised of independent venues across New York State, as well as independent promoters. Our mission is to represent our constituency with the goal of securing independent arts within New York's priceless live performance culture. And right now we have over 200 members. We're both nonprofit and for-profit. If you think you fit into who we are, we'd love to hear from you, and we'd love to have you join us as a member. This past year, we've really worked on a significant amount of city and state advocacy, which was a new thing for this sector. It's not for the nonprofit culturals, but for the independent for-profit venues especially, this was not something they engaged with very actively. So we've really made some inroads into speaking not only with city council and the mayor's office, but on the state level and looking at the state funding. We also have a weekly field call every Thursday, so come join us if you're interested, let me know. I will not talk about the reopening guide because that is absolutely Morgan's wheelhouse and she's fantastic at it. One of the initiatives we also did this past year was called Stories from the Stage. And if you go on our website, naiva.org, you can watch some of these videos of the various both for-profit and nonprofit stages that were closed during the pandemic and hear their stories. And they're really well done. And we're pretty proud of them. So right now we're in a sort of the zone of pushing forward with working in coalition. NAIVA is partners with NIVA, which is the National Independent Venue Association. We worked on a lot of advocacy for Save Our Stages, which became the Shuttered Venue Operators Grant. And we're continuing to partner with other for-profits, nonprofits, Broadway. We love when we hook up with Lucy over at New Yorkers for Culture and Culture at 3. We've made great friends with Greg, which we're really excited about. And we're always looking to continue to partner and to deepen those coalitions so that the sector really becomes an arts and culture sector in New York State and not sort of divided by for-profit, nonprofit, dance, music, right? We all support each other. And I think there should be some building around that. So that's the quick pitch of who we are. And I'm always happy to take questions, but I'm going to kick it over to Morgan because this seems to be a Key to NYC day, and that is 1000% her wheelhouse.
Hi, everyone. I'm going to go ahead and share my screen. Let's hope I can figure it out. I'm a genius. Can you see it?
Yes, we can see it.
Yes. Okay, great. All right. So basically, I head up the NAIVA Reopening Committee, and the primary focus of the Reopening Committee is both advocacy on the part of our 200+ members and support and guidance. A lot of that for us has had to do with sort of interpreting this very bulky language, sort of very governmental language written by people who are not operators, who are not in our space, who have sort of written these vague bits of guidance, and reinterpreting that guidance into more operationally sound sort of guidelines. So just a quick overview on sort of the economic impact of New York independent live music venues. It's 25,000 jobs, 725 million in wages, and over $2 billion in economic input. I share these numbers just so that everybody can remember how big we are as a sector. We remind folks in government when we work with them a lot this information, and I encourage all of us to really internalize this, not just our worth as contributors to culture, but also that we are, an important economic engine for the state and the city, and that it is reasonable and appropriate that they interact with us as such. So I'm sort of going to talk about where we've been and then where we're going, because I think an overview of what's happened in the past 18 months with the reopening committee will sort of help inform where we're going with the, where we're sort of going in the future, and may also help folks on this call craft questions that we can answer for them. So the first one is really advocating for members, and that involves a lot of, on this weekly field call that we have, sort of saying, okay, here's the newest guidance, it's just come out, we've seen it. Here are the questions, here are the things that immediately jump out to me. What are the things that jump out to you as members? Collecting that information, sort of getting it into one place, and then bringing it to our relationship to the city and the state, and asking very direct questions. And literally, small venue in Rochester can say, I have a specific question about XYZ thing. We had a weekly call with the state, with the human who writes the guidelines, and I can go and have a conversation with that human who writes the guidelines and say, what about this question? Get those questions answered. In the process of doing that, we also found that the state, sort of these dialogues helped the state better understand how our sector works, which I think is something that historically they've not had a great grasp on. I think that arts and culture and entertainment feel very elusive to most folks. So part of our goal has been to sort of overcome that. And then in addition to these calls and conversations we had with the state, we actually did help them craft some guidelines. We got sort of first looks at some of the early mandates and guidelines that were coming out, those that started coming out in February, March, April, May, June, and saying, red flagging it and saying, this is an absolutely not operationally feasible regulation. Can we suggest that you make a tweak to the language and write it in just this way? I would say they probably listen to us 30% of the time, but I'll take 30 rather than 0. And then again, as I mentioned at the top of my little time here, we also provide a step-by-step operationally relevant guidelines for members and for the broader community. It's an open source document. It's called The Guide. It's covidvenueguide.com. It currently has not been updated since June, so it doesn't have the most recent Key to NYC updates on it. And that's mostly just because I'm a one-woman show, and sometimes I run out of steam. So we are looking to update it in the next couple of weeks to reflect more Key to NYC information. It was initially, very early on, it was a broad open source document for all nightlife globally, because we've been entertainment venues globally, because we've been working with clients internationally. And then as New York became really the bellwether for how how COVID regulations and mandates are rolled out. And really, New York State in many ways was obviously the first, hit by COVID, and then one of the first to adopt vaccine mandates, had some of the strictest regulations. It's well known that the New York Department of Health is one of the strictest departments of health in the country. So we sort of recrafted the document to focus on New York, because we felt like if it'll fly in New York, it'll pretty much fly everywhere. And then let's talk a little bit about where we're going. So obviously we have Key to NYC. We are finding, I asked some of the questions that members have of the commissioner and the city on the call today, which are, really getting our hands around exactly how to enforce these vaccine mandates, how they're safe, how to, make sure we are ensuring equity of access, while also keeping staff and patrons safe. And my focus is primarily to take the information, ask the questions, and then feed the information back out to members. While I do advocate on behalf of membership in terms of like, here are the questions that have been asked, please give us answers. I do not sort of, as a rule, get into a conversation about like, this is fair, this isn't fair. I sort of feel like somebody's just got to be heads down, right? Focusing on what the actual rules are. And there are other people who, like Tamara, who are much better equipped to really get into the sort of, lobbying of things. One of the things that's just come to our attention this week, which some of you may not even have sort of put on your radar yet, is Governor Hochul declared I can't remember exactly what it's called. I want to say it is a respiratory emergency, state of emergency in the state, which kicks into effect something called the HERO Act, which effective immediately requires all venues and all operators, all theaters, restaurants, architecture firms, everybody to have it's a Department of Labor mandate that revolves around how to make venues safe for employees in this time of, in these extraordinary times. I have some questions for the state about how some of these regulations, like mask mandates and a few other things, jibe with what we're currently seeing in the city and in Key to NYC, which I don't have good answers on yet. And it makes me feel a little bit better that the commissioner didn't either, and it's not just me. So that is something that will need to be worked through. I will say that if anybody is interested in learning more about the HERO Act or what you need to do in terms of implementing a safety plan for your venue, let me know, or when I'm finished with my spiel here, we can talk about it. The Department of Labor has provided numerous resources and templates with which to craft these safety plans. And I'm also there's also something I have learned about in the past few weeks, and is one of the major things that has come out in the HERO Act, which is that we are now finally, we've been dancing around this for ages. There is language in this HERO Act around making sure that your venues are properly ventilated and that you're using some sort of air filtration system that meets a certain standard. I'm not in any way affiliated with this thing I'm about to say, but there is a product, an open source product called the Corsi Rosenthal Cube, which basically duplicates somebody sort of jerry-rigged this dope system. And it's basically the equivalent of a very expensive, $1,500, $2,000 filter that you can make for about $150. Venues all over the country are using it. Here in New York State, Rochester Fringe Festival is using it to meet all of its air filtration regulations. So again, we can talk about that when I sort of finish my spiel here, but that's going to come up in the HERO Act. You're going to see it in the guidelines that you need to present. In the plan, in the safety plan that you need to present. And it is a great resource, and it's extremely affordable, and it's totally DIY, and it's completely open source, and I love all of those things. And then lastly, we are headed in the direction of developing new relationships with the Hochul administration. As you can imagine, we devoted a lot of time and energy and resources into engaging with the Cuomo administration. And obviously now there's a new sheriff in town. So we are sort of focusing our efforts on communicating with the Cuomo administration, with the Hochul administration, the Hochul administration, and creating inroads there, as well as expanding our relationships with the city. We're really seeing sort of the landscape of New York City and New York State politics shifting. We're at the end of an administration in our own city. It's reasonable to imagine that whatever we're dealing with is going to expand and, is going to continue into 2022. So a lot of what we're doing is really figuring out how to create sustainable relationships and, positively affect public policy that affects our industry, while not having to pivot and recalibrate with every, resignation or scandal or change of administration. So that's kind of the broad overview of where we are, what we've been working on, what's been, going on here and with us. I have loads of resources to share if anybody has any specific questions. So that's sort of all I have in terms of a 30,000 foot view. And I'd love to hear if anybody has any questions or bits of feedback.
Thank you so much, both of you, for sharing. If there's any questions, feel free to drop those into the chat.
Yeah, Sarah, it's a good one. It's been linked in the chat. So open it up and then just Google also like Corsi Cube, and it will come up. It literally requires like one of those very inexpensive, home filtration systems, and then basically putting two more high-powered MERV 12, 14, however high of a MERV you want to go, filter on that, and then sort of jerry-rigging a ceiling system. And they're extremely effective, and they're being, they're starting to become widely recognized as effective replacements for more expensive air filtration. And frankly, even if this was not a requirement of the HERO Guide, the HERO Act, I would say that, if you can get better air filtration in your, space for $150, do it.
Could you tell us a little bit about how the Key to New York City mandate has affected your venues, or like maybe a little bit more on what you've been hearing as feedback from everyone?
Yeah, so, I think one of the primary challenges, that everybody's expressed is, well, is this idea that we as a sector, we as an industry are being used as the stick for the vaccine carrot, right? And it's like, nobody can do anything fun if you're not vaccinated. And that, and it was brought up on this call earlier, that there's no funding for that, right? And that we've been in no way compensated for basically being used as a political tool. So, membership has expressed a lot of frustration around that. Operationally, because there is no standardized way really to test for proof of vaccines, other than, of course, we have the Excelsior Pass, and then of course you can present your COVID, your vaccination card, and of course you have your, there are mechanisms within the Key to NYC app that also enable you to prove your vaccination status. It is frustrating for venues who are not, and for venue staff who are not medical professionals, to know what is an appropriate proof of vaccination, what isn't, how to spot a counterfeit vaccine card, if venues should even be in the business of having to establish the veracity of those sorts of documents. And moreover, sort of pointing the finger back at the state or the federal government, saying like, you guys haven't actually come up with a good system to, to prove people's vaccination statuses. So it's frustrating to have that mandate sort of put upon us without much guidance on how to read vaccination status. And then of course, there's the issue of, venues that are only check, and this is obviously specifically for venues that are over, have age restrictions. What sorts of IDs are we comfortable accepting and checking at the door? How does that jive with people's immigration status? Do we create two-tiered systems of, access for folks who are vaccinated and folks who aren't? Does that feel ethically appropriate? I think a lot of the things that I've sort of heard alluded to on this call are very, very much mirror what we're seeing within our membership in independent venues. And then I also think there's concern about the long haul here and how long this is going to last. And, am I making adjustments to the layout of my venue or investing money in training staff, and that, we're going to find in 6 weeks that this is no longer necessary. All of those same challenges I think that people have had throughout the pandemic of like, how much money, time, and energy do I need to be investing into the newest thing when, there are no metrics, there is no timeline, available to us.
Thank you for all of that. It is echoing, what we're hearing as well, and kind of I think what boots on the ground people are, feeling and kind of dealing with. I was gonna also ask you if implementing these mandates, have affected ticket sales for people, or kind of like what is the chatter kind of around that at the moment?
Yeah, so I think that we are it's a really interesting question. I'm sort of smiling because we just had a conversation like this on a podcast with Event Safety Alliance. And ticket sales in general across all sectors nationally are down. Ticket sales are down in markets that don't have vaccine mandates, almost at the same rate as they are in markets that do have vaccine mandates. We're seeing ticket sales in general are down across the nation about 30%. There is no, as far as we have been able to observe, direct corollary between vaccine requirements and low ticket sales. I think low ticket sales are more a reflection of general uncertainty in the market, people's general level, of like, I'm buying a ticket and 40% of the time the event's being canceled. So I think it's more to do with uncertainty than vaccine mandates. I will say that what we are seeing a lot of, and I work in other markets as well, so some even in the Southeast, I work in Nevada and then some international markets as well. And one of the things we're seeing is a lot of artists are coming with COVID riders. So we have many artists who will not perform at mixed shows, so will only perform vaccine only shows. We're seeing a lot of artists who have mask mandates want to see mask mandates in venues, artists who have very specific requests about the way that other staff can interact with them, that the staff that's dealing with them or driving them or managing their green rooms need to be vaccinated or need to be masked or need to be tested. So we are seeing a lot of that. And I actually think, if anything, what we're seeing is there are many performers who are choosing to skip markets. And I'm talking like A and B list level talent, top tier talent, who are choosing to skip markets or delay tours because folks are not vaccinated or because it's a market where there's extremely high rates of COVID. So I actually think, in addition to, to answer the question in two ways, no, I actually don't think that the 30% drop in sales is directly correlated to vaccines, but I do think that the changes in behavior of artists and their touring, I think we are going to see and have been seeing and are continuing to see changes there based on vaccine mandates. And we're actually seeing the inverse, so that artists are less likely to play in a market that doesn't have a vaccine mandate or that doesn't have pretty stringent masking or public safety requirements.
Great, thank you. That's, I think really helpful information to hear, especially as, a lot of people are are kind of dealing with that as well, to kind of relate it back to the national level, I think is good.
It's not just you.
Yeah. You know, sometimes it does feel like it's
Yeah.
just us, especially with all of this like Zoom social isolation, you know.
And a little secret, all of those like festivals and events that have been canceling because of COVID and unforeseen circumstances, it's low ticket sales people. So just that's what's happening.
Yeah. So in terms of this with low ticket sales, right? Like looking ahead to kind of like the fall and the winter, like how are your venues kind of thinking about like the virtual versus in person versus hybrid, or like what are some of the discussions around that maybe?
I think that people are exhausted with virtual anything. I think that you know, it depends on the industry. I actually recently did a presentation for PEN America, so that's for, you know, booksellers and the literary industry. And one of the things that they're seeing in their market is that they, or in their sectors, that they actually do have a lot of people who would rather have online activities. They're doing things like online poetry readings, online book signings. So you sort of like go, you can ask questions of the, you know, of your favorite author, and then have a signed book sent to your home. So I think it really depends on the market and on the sector. I would say, and Tamara, you let me know if your thoughts are different on this, but I would say in the live event sector and the live music sector and nightlife, people are really over virtual events, and that the value may come from, you know, recording events and then having them streamed after the fact. But this idea that we can charge for that as a particularly appealing commodity to people is really diminished. And it's like, I don't really need to pay to see an artist because they're going to do it on their Instagram live for free in an hour and you know what I mean? So I think that the idea that that's a monetization opportunity, I think the monetization of that moment is gone. I do certainly think there is value in live streaming, just in terms of like improving access. Frankly, it's a good marketing tool. Maybe you want somebody in Buenos Aires to see what you're doing in New York, and by all means, put it on YouTube. But it should not, I think, be thought of as a replacement for, you know, or as a monetization opportunity.
Yeah, I agree with Morgan. I don't think we're going to see in the live performance space what we saw in, say, like the cultural arts and education space last year. I think it's either live or it's canceled for the most part with the majority of our membership.
Yeah. And moreover, you know, we are already seeing major tours or just, you know, I mean, we've seen this with tons, you know, Garth Brooks has a canceled tour. I can't think, somebody else, Florida Dixon Mason Line canceled their tour, and a number of other really big acts canceled their tours and are just postponing tours until 2022. Friends of mine who are, you know, artist managers are just like, we're just not even messing with 2021 right now. We are rescheduling everything for spring of 2022. So I think what we're seeing is venues, you know, and one of the things we're encouraging venues to do is like pivot to your local talent, focus on cultivating and developing a really healthy local scene with, you know, local artists that are not as expensive as, you know, some of these national or international touring acts. And also, and the sort of the byproduct of that is really cultivating community and, you know, and engaging folks locally, which I think in this sort of these last 18 months, 20 months, however many months it's been, 95 years, whatever it's been, that, you know, I think we're realizing that it's nice to have connection with the people close to us and in our neighborhoods and in our communities. So we're really encouraging venues to focus on, you know, acting local, right? And because, you know, the forecast for the next 6 months is not good. The ticket sales are not good. Frankly, in the United States, the trajectory of the virus is not good. You know, I am seeing countries here, I'm in the UK right now, but countries in Europe are starting to close again for flights from the United States. The United States is still closed really to international travel. The NIE visa situation for international artists has completely broken down, and people are not getting artist visas. People who got artist visas 6 months ago are not getting artist visas today. So it's not, the forecast is not good. And, you know, people are really getting as creative as possible, or frankly, like speed cramming it in for the next, you know, little while until, you know, we get slammed by the next big wave, which is coming.
I appreciate the intel, especially on like the shift to local, because I feel like that's been, you know, something from the pandemic. And I know a lot of like conferences and large group memberships, like I'm a member of like the International Association for Dance Medicine and Science, and like the call from, you know, their membership is also, we want more regional, or we want more local, like hyper local events to like connect with people, because, you know, I think it's partially that, like, you know, tired of Zoom and tired of virtual that you're talking about, but also that like, well, how do we like, you know, make this local connection kind of like grow further? So speaking of things that are local, we actually had a question that came in through the chat, was if any of your venues, or if you know of any venues that were impacted by Hurricane Ida, and then what kind of support do they need, either short-term, long-term, or both?
Tamara, I think that's the question. Yeah, sorry.
Yeah, I haven't heard anybody yet. Nobody's reaching out saying that they need support. And first of all, that's so kind to ask and to offer, and we really appreciate that. And I will take that question back. But right now, knock on wood, we're not hearing that.
That's good. Because I know that, you know, like a lot of venues or things in New York were flooded, you know, or had some damage to it. So it's good to hear that nobody in your membership has suffered. Something else that came through was how venues are handling or planning to handle events with like food or drinks. I think this is probably in terms of masking, but you know, with all of the new requirements and everything like that.
So it's a really good question. Obviously, it goes without saying that currently there is not a mask mandate in place because we have a vaccine mandate, and the vaccine mandate supersedes the mask mandate, but obviously some venues are still choosing to enforce masking. What we are seeing in venues that are continuing to enforce masking is there are sort of two methods of operation. One is there is an area of the venue in which you can consume your drink. You can stand up, you can take your mask off, consume your drink. If you're returning to a dance floor or a theater or a seated area, then you would put your mask back on when you go back onto the dance floor, or when you go back into a seated area, and there's no food or drinks on the dance floor or in the seated areas. That's one way of handling it. Other venues are just doing the thing of like, you lift your mask up and you take a sip and you put your mask down. But for the most part, we don't have a ton of venues that serve like substantial food items. You know, it's like burgers and hot dogs. It's sort of like standing food, nothing particularly elaborate. It's a lot of drinks. And frankly, you know, the general feeling is everybody in the venue is vaccinated, including staff. And there is not, we are finding that many of our venues are beginning to not have mask mandates and are simply pivoting to the vaccine mandate. Does that answer the question? I feel like maybe that was a little bit of a thin answer. Could you ask Sarah maybe if that person would like?
Sarah, feel free to unmute. Does that answer the question?
Yeah, I think that clarifies things. Thank you.
Great. So a few other questions. Also, please continue to drop questions into the chat. They're super helpful. One was, so if you can tell us maybe a little bit more on what other policy areas you advocate for, or how your advocacy efforts have kind of worked around all of this.
Yeah, Tamara, do you want to talk about like SVOG and all of the other sort of like non-policy stuff? Well, it's policy stuff, that's not my policy stuff.
Sure, yeah. So obviously, we were really involved with the Shuttered Venues Operators Grant, which, like I said before, started out as Save Our Stages. That was a federal piece. And if anybody on this call has questions about it, I'm happy to field those. So that was a big lift. a lot of that advocacy happened nationally, but getting Nadia Velazquez was the chair of the Small Business Committee in the House, and obviously Senator Schumer was Senator Schumer and now the majority leader. So they were both integral to getting this piece of legislation to move. So that was a big piece of what we were doing, ton of meetings on that. And then we really pivoted to the state and said, well, thanks, Morgan. We sort of pivoted to the state and said, well, you know, all these other states in the nation were doing things for their performing arts or for their independent venues, nonprofit, for-profit, and New York wasn't doing anything. And they were saying, well, we don't have any money. Okay. So that went on for a while. And then ARP came through and there was like, well, there's going to be a lot of money. And state, you know, I think New York State got something like $13 or $15 billion from the American Rescue Plan. And we said, well, we're like listed by HUD, which is the Housing and Urban Development agency federally, and we're like the second most harmed industry. Like, what can you do for us? So NAIVA really partnered with New Yorkers for Culture and some other people in the community. Carnegie Hall was one of them, and we took 1 million meetings with every state legislator that would talk to us to say, hey, thanks, Greg, really said on the state level, like, hey, you know, we have this membership, and then there's, you know, thousands of performing arts groups and independent venues, for-profit, nonprofit, and we need you to help because we're closed, and we're closed by state venue at that point for something like 15 months. And it was sort of successful. I don't know if we were as successful as other states. And I think there's sort of like, because New York State is this traditional funder of arts that's significant, we kind of got split by for-profit and nonprofit and weren't seen as a cohesive sector. And so the money got split up. So that's when you got, if you're on the for-profit side on this call, you had access to the New York State Small Business Relief Fund. And depending upon where you were, you know, size-wise, you were eligible to apply there. And nonprofits, there's a recovery fund with New York State Council on the Arts. Depending upon how much money you got, or if you were a previous funder, there were some opportunities there. And then we did some advocacy to get some rule implementation. Once legislation is passed, that's not necessarily the end of the road as to what happens to it. Once it's passed, it then goes to agencies, and they have a certain amount of agency discretion to say how they're going to implement the rules. So everybody heard there was $800 million allocated off to small business, but then they said, well, your income had to be less than 500,000. So that cut off every business whose income revenue was over that money. And we were able to get some of those things changed. So we've worked really hard on that, and we're now sort of trenching back in with the city. We're engaged, as everyone can see, with Key to NYC, which is really important. And personally, and I'll speak for myself, I think if the city wants to make us implementers of public health policy, that there's a cost to that, and they should be supportive. You know, it costs money to train staff, and it costs money to put people at doors to check cards, and it costs money to go check with your legal counsel to see what you are and are not allowed to do. So we are working on that next from a policy piece. Sorry if that was a little babbly.
No, that was excellent. I'll just say, if there's any other questions, feel free to drop them into the chat. There's just one more that I kind of want to end up with. That at the beginning you were telling us about NAIVA and kind of, you know, who was eligible. So if you can just like remind us, like, who's eligible and how do you join, and like how do you get kind of involved with all of the wonderful work that you're doing?
Absolutely. I'm going to drop my email in the chat. So if anybody wants to reach out to me, I'm happy to have that conversation. You can also go to our website. So if you're a venue, you can be a for-profit or a nonprofit, but independent, meaning you're not a subsidiary of AEG or Live Nation or maybe Broadway, right? So independent in the sense that, you know, it's not necessarily based on size, but it's based on how many of them you are, right? So Live Nation's in many states and they have many venues. So maybe you're independent, you have like 4 venues across the country, like some of our comedy owners do. And as well as an independent promoter. And we know promoters are going into both for-profit and nonprofit spaces as well. And that's mostly what our constituency is. We have a few talent agents here or there, but we mostly say, well, they should probably join. I think it's NITO, right, Morgan, for talent agents. So nonprofit, for-profit, independent venues, and promoters. And I will drop my email in the chat right now.
Great, thank you. Tamara, we also send like a follow-up email on Mondays for people that weren't able to join the call. Do you mind if we include your email for all of those people?
Yep, totally fine.
Great, thank you. So I just wanted to say thank you to everyone for joining us today, and thank you to our wonderful group of speakers, Commissioner Gonzalez, Tamara Kasheki, and Morgan Dean for their expertise and contributions to today's conversations. To our attendees, thank you for being avid contributors and offering your insight and questions. A final thank you to our accessibility providers, our ASL interpreters, Veronica and Alana from Sign Nexus, and our captioner Jean from the Viscardi Center for their invaluable support. I just have a few like reminders and like housekeeping to kind of end up with is we do have a field-wide call next week where we'll be joined by Michael Bishop, who will discuss his new Artist Care Act that he is advocating for. After this meeting, we will resume our bi-weekly calls. So we do have 2 back-to-back this week, but after that, we will resume these calls every other week. If you have anything that you would like us to consider for a field-wide call, please, drop it into the chat. You can also email me, which I will put my email into the chat, because we, try to curate these for the community. So if there's any topics or things that you would like discussed or speakers that you would like, feel free to let us know. We do send out the notes on Monday. So those are the next steps. And thank you everyone for joining today. I'll give you back, 15 minutes of your time. Thank you.